First, lacing is what I'm looking for. I'm going to do is called a lace lock, and some of you may have been taught by someone like the Athlete's Foot, Active Feet, those guys that you may have bought your shoes from. The reason that we do a lace lock is to stop your foot from sliding forward in the shoe, particularly with your downhill stuff. If you've got blisters at the toes, or you've got problems there, or if you've got anything at the heel, the firmer your shoe is, the less problems you're going to have, okay? If a lot of people think, oh, I've got a blister, or I've got problems with my heel, I'll make the shoe loose, and that will create, that's actually going to be worse, because you're going to get the friction on the back of your heel and your foot's going to slam into the front of the shoe. So what we do is, instead of, normally what you'd do if you were going to use this final hole on the shoe, is you'd go across and you'd sort of do your laces up normally. Instead of doing that, what we want to do is we want to come back around and form a loop, okay? And we'll do the same on the other side. So what you've got is like little dog ears, okay? Then you get that piece of lace, and that threads through the opposite dog ear. Same on the other side. This one threads through the opposite dog ear. And then what we do, and this will be easier if you want to stand sort of up on here, or just sort of yep, cool. Okay. So then what we do is we pull all the laces sort of nice and firm, tongue's nice and tight, and then what we do is we pull down this way. So normally when you do your laces up is you pull that way and then you do the lace. By pulling down, you lock the lace. So you've got these little locks over the lace, and then you do the laces up normally. And what that does is just creates a really firm grip around the heel.
Sorry, which way? Yeah, I couldn't see that.
Yep, so I'll do that again for you so that you can see. The one negative about this is it takes a bit longer to get out of your shoes, and you can't take your shoes off without doing your shoelaces undone.
Yeah.
Which is better for your shoes anyway. So you've got your little dog ears, okay? This lace goes through the opposite dog ear. This lace goes through the other one. You pull the laces out, and then sort of down like that to lock it down, and then so what you shouldn't see is this. You don't want those loops to become big. You want them to become very small and locked over there, and then you do your laces up as you normally would. Now, if for some people they sort of sometimes find that it just feels too constrictive having that lace lock at on the last hole of the shoe. So what you do is you just come down a level. So you just undo the laces and you start at the second to last hole. So form a loop, opposite loop, down, and then lace goes up. Okay, that's lace locking. The second one, actually you're right to stand up there,
yep.
Good like that. The second one is, if you've got, put your foot in. If you've got a foot, like let's say you've got some blisters on your toes, the front of your foot's just really quite sore, and you're really not coping with that, then what you can do is you can open up the front of the shoe, and all you do is you take the laces right out, and you might find that it's happening on one foot and it's not happening on the other. It's okay to do one shoe and not the other. That's fine, as long just to sort of make yourself as comfortable as possible. Actually, slip your shoe off, it might be easy to take it off. So what you do is you just start lacing bring the laces up the side of the shoe using the hole. So rather than crossing across the way you normally would, and then if you pop your foot in there, and then from that level, or let's say you're really having some issues in that front part of your foot, you might go up one more level. Okay, and then you start crossing over, okay? And this way, the ideal situation is that you'd use the loops sort of to the highest point you can, and then you'd lace lock, like we just showed you before, okay? And what that does, as Alistair will sort of tell you, is that he can sort of move his toes around a little bit more. It's a little bit looser through here. Now it's a similar, and then you obviously lace lock and keep, because you want, obviously you haven't got as much holding the shoe onto your foot, so you want to make sure that the laces sort of around here are going to hold, you know, by lace locking, that's going to keep the shoe in place. The other thing that you might find, and this can be for two reasons, you might have a very prominent area on your foot around this point here. Some people sort of have lumps and bumps that tend to get aggravated, or you might have an insertion of one of the tendons that inserts onto the top of the foot that might just become inflamed, particularly with downhill walking. There's a tendon, sort of a muscle that comes across here and inserts down to about this point, and it's an anti-gravity muscle. And so as you're getting tired and your foot's slapping going down that hill, that muscle's working overtime to try and stop that slap, and often people get really inflamed and really sore on the top of that foot. So what you'd do is you'd sort of cross over at the bottom level. So you'd start normally at the bottom and you'd cross over here. And then you'd miss the part that you were having the problem with. So let's say it's sort of smack bang in the middle of the foot. Oops. And then you'd cross over up at a higher level, finish the taping off with a lace lock. Okay, in the same way. And what's really good is if you guys know how to do this and one of your teammates is complaining of something, then you've got something in your armoury to say, hey, let's try this. It might work, you know, rather than lining up for 2 hours to see the physio or the podiatrist who might tell you exactly what I've just told you. But it's just really handy to sort of have those skills. Placing. Thank you, model.